I were to go back and do it all over again, I'd say I would have done fundraising differently. I'm pretty happy with how things turned out from a product market perspective. The biggest mistake I feel like I see, I'll read her, TJ says there's a lot of attention going into big major areas. Jason's solving a patient engagement problem. I actually like what they're doing, but there's way too many companies trying to solve a patient engagement problem. And the reality is a very, very small number of them will exist in 2 years. So yeah, I iterate what TJ says. In terms of fundraising, yeah, get into healthcare circles, because the healthcare circles, most people who don't know healthcare won't fund healthcare. So come to these events, go meet other people, and get in those circles, because once you're known in healthcare, you'll get introduced to other healthcare people who can invest, because early investors are like the rarest, hardest thing.
I think I have two comments. One is if you work for 35 years in health IT at the corporate level, whether for health insurance companies or for hospitals or those sort of things, in the startup world, you can probably forget about much of the processes and procedures and things that you sort of ingrain yourself with. That's sort of good news in the sense that when you're starting over and you're actually building a startup from the bottom up, you can make it your own, and that's what I really like about this. The other thing that when Nora mentioned this bugaboo called HIPAA and all this privacy and regulation and that kind of thing, if you're going to work in health IT, you've got to really embrace it. If you fight against it, you're swimming upstream. And many of your clients that you're going to try to work with, that's one of the first or the second thing they will ask you right up front is, what is your position, what is your view, what is your focus on the privacy of patients, the privacy of data, those sort of things. So if you embrace it, you design for it, you actually ask people to come in and help you. If you don't know what it takes to actually work in this space with those sort of things, make sure you find good advisors around you that can help you, slog your way through it.
Now my perfectly engineered final answer. I agree with her, particularly trying to find a niche. I think part of that is delivering results. I think the most important thing, rather than describing what you've built or what you're offering, is instead tying it to what your customer is going to get. And part of that is picking a specific enough customer that you can do that. And the second part of that is knowing who your customer is. Knowing, because there are a lot of players, so the employers, the patients, the providers, the payers, the government, and it can be tempting to try to kind of dip your pen in all those wells. But then it becomes really hard to sort of say in a single sentence what you do, what your soul is. So I would encourage anybody to first think, who is my customer? What is the value in concrete terms that I am delivering? And then the product and the functionality will kind of proceed from that.
We're going to do one more totally spontaneous question, and then take a couple questions from the audience.